This week's assessment is musculoskeletal and neurological. For the musculoskeletal system, we'll start with questions. Do you have any problems with your joints?
Not that I can tell you.
Okay. Normally, joint pain is one of the most common concerns for people seeking care coming in. Any stiffness to your joints?
No, just in the morning.
Any redness, swelling, or heat?
Nope.
Any muscle pains or cramps or any weakness?
Not recently.
Okay. Weakness, cramps, any of that, it can be musculoskeletal, but it can also be neurological, so we would check for both. Any bone pain or deformities?
No.
Okay. When there's fractures, there's usually pain with an increased movement. And then if it's not a fracture, other pain is usually dull, deep, and it's unrelated to movement. Do you have any back pain or numbness, tingling to your legs or feet?
No. Any
Any problems performing everyday duties?
No.
Any occupational hazards that can affect with your muscles and joints?
No.
If there is any swelling noticed or anything, it could be excess joint fluid, could be inflammation, or anything like that. Normally, you palpate all of the joints, which would be everything. Check range of motion and strength. So we'll start with the TMJ, which is up here. Go ahead and open your mouth. And basically, you're trying to feel for any crepitus. You want to make sure the movements are smooth, which yours felt fine. C-spine, you're checking the neck and you're looking for stiffness. So ear to shoulder on both sides, pretty even. Chin to chest and back. Okay, and look to the left and right. Everything looks equal there. You're just checking for smooth motion again and looking for any stiffness. Usually with that, some injuries, you can't put your shoulder, ear to your shoulder as far on one side as the other. Then shoulder pain, you check range of motion, so raise your shoulder up and down. And can you make full circles without, on a bed it's hard. Yes. Okay. And then you also want to check when you're moving, just for any crepitus or anything that may be moving. And hers are fine. With elbows, you want to check for any swelling, tenderness, or anything. I don't feel anything there. And you can move them up and down fine.
Yep.
Not feeling any pops or anything. Okay. And then the wrist, hand, and fingers, same thing. Flex down, up. Usually the range of motion is the most common loss in your wrist. If you do the Phelan test, you put your hands that way. If that doesn't cause any pain, that's a carpal tunnel test.
Oh.
So if you get numbness or tingling or anything from doing that, that's a sign of carpal tunnel.
Okay.
And then also tapping the nerve on the inside. When you check if there's tapping and that creates any pain or anything, that's another sign for carpal tunnel.
Okay.
Seem good. Now for your hip, I'm going to lay this down here. You also want to check for crepitus on that, but just raise your legs straight up. And other side. Any pain?
Nope.
And then bend your knee. And this one. Okay. Now put this foot up to your knee. Like that. And then let your hip fall out and like over as far as it'll go. And then same on the other.
Okay.
I know it's awkward. And then the other side.
I'm wearing pants.
Okay. And then ankles, you want to check flexion, dorsiflexion. Everything looks good there. Normally, when you check the foot and the toes, you want to check for hammer toes or bunions or anything like that, which we're not going to have you take your shoes and socks off since we're at work. And then usually you'll check for the back. You want to check alignment. If you put your feet together, you usually want to check to make sure that the feet are the same length. You don't have one leg longer than the other. And then to check for sciatica, you just raise one leg slightly straight and just make sure that there's no pain in the lower back or anything that could be the sciatic nerve. And then normally they would be in a gown and you would be able to visualize their back, make sure that there's no curvature, scoliosis, or anything like that. Moving on to the neuro exam. Questions, any frequent headaches or head injuries?
When I come to work, I always get a headache.
Me too.
That's about it.
Any dizziness, seizures, or tremors?
Nope.
Any weakness or trouble with coordination?
No.
Any numbness or tingling?
Mm-mm.
Any difficulty swallowing or speaking?
Not usually.
And any history of stroke, spinal cord injury, meningitis, anything like that?
Nope.
And any exposure to insecticides or leads?
What?
Lead.
No. No.
Okay. You
So
want to
the
be
legs.
aware. You want to be aware of that, and you want to watch. You also want to know the patient's medications, just to make sure that there aren't side effects from the medications instead of occupational exposures. So, usually with the neuro, you're going to check the cranial nerves. Cranial nerve 1 is the olfactory nerve. We don't usually test that. It basically is a sniff test of one nostril and then the other. About the only time you're going to use that is if there's trauma or altered mental status, or if they complain of a loss of smell. Cranial nerve 2 is visual acuity. It's the optic nerve, and you're basically going to do the exam with the ophthalmoscope like we did in week 1. Cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens. You're basically going to check the pupil size and the equality. All right, the neurological system. Any frequent headaches or head injuries?
Nope.
Any dizziness, seizures, or tremors?
Nope.
Any weakness or trouble with coordination?
Nah.
Any numbness or tingling?
No.
Any difficulty swallowing or speaking?
Nope.
Any history of stroke, spinal cord injury, or meningitis?
Mm-mm.
And any exposure to insecticides or lead?
No.
Okay. You just want to be aware of risk factors of things that you might be in contact with at work. Know the medications that everybody's on for interactions as well. Checking the cranial nerves. Cranial nerve 1, the olfactory nerve, we don't really test routinely. It's a sniff test of one nostril at a time, and usually that's done with trauma or altered mental status or loss of smell. Cranial nerve 2 is the optic nerve, and you check visual acuity, and you usually do the exam with the ophthalmoscope like we did in week 1. Cranial nerve 3, 4, and 6 is the oculomotor, trochlear, and abducens, and you usually check pupil size, inequality, light reaction, and for any nystagmus, which is back and forth oscillation of the eyes. So we'll check your eyes. Your pupils are nice and equal, and they are reactive to light. Any blurriness or anything with your vision?
Nope.
Okie dokie. Cranial nerve 5 is the trigeminal nerve. Usually you are going to check the corneal reflex. You're also going to check for sensation and then clenching of teeth. So I'll have you clench your teeth and don't let me open your mouth. Nice and strong there, and everything feels equal. Go ahead and close your eyes and let me know when you feel this.
Yes.
I'm going to tickle, sorry.
Yes. Mhm. Mhm. Mhm.
All right, now you can rub your face.
Thank you.
Cranial nerve 7 is the facial nerve. So I'm going to have you smile and frown and close your eyes tightly and don't let me pull them open. We're good there. And then lift your eyebrows, smile real big and show your teeth. And then you're going to puff your cheeks out. And when you check for this, you want to push on the cheeks and make sure that the air is coming out equally on both sides. You also want to check for muscle weakness, loss of movement, and any facial droop that can be signs of stroke or Bell's palsy. Cranial nerve 8, you just test by normal conversation.
Sorry,
Okay, that is the acoustic nerve. And then cranial nerves 9 and 10, the glossopharyngeal and vagus nerves. You want to check for symmetry. You want to check the gag reflex, which I will not do. And then you want to have them say ah, so open up and say ah, and just make sure everything's midline and there aren't any problems. Cranial nerve 11 is the spinal accessory nerve. That checks the SCM and the trapezius, so you want to just check for equality and the strength in the shoulder shrugs, make sure everything's equal. Good there. And then cranial nerve 12 is the hypoglossal, and you want to inspect the tongue to make sure there aren't any divots. You want to have them protrude it and make sure that it stays center, and then have them say light,
light,
tight,
tight,
and dynamite.
Dynamite.
And that just helps you with certain letters with pronunciations. Then from there you check the muscle groups. You want to check strength in all of the muscles, which you can also do as a part of the musculoskeletal when you're checking joints. You can go ahead and check for strength there. You want to check the gait while walking, make sure that it's straight, they're upright. Check for any involuntary movements. And then also if you can pat your hands and flip them, and then finger to the nose.
Oh.
And other hand. Other hand.
Oh.
Okay, good job. And then the last one I'll have you do is stand up, and we'll check the Romberg. So feet together and close your eyes. You just basically want to make sure that they don't start swaying or they lose their balance or get dizzy. All right, thank you very much.
You're welcome.
And then normally you check reflexes, which would be the inside of the elbows. You can check the wrists. You can obviously check the knees. Just make sure you don't get kicked. And you can check the ankles. So that concludes our neuro exam.
All right.